Bronchodilators are the medications that make the breathing easier by relaxing the muscles in the lungs and widening the airways. They are commonly used to treat conditions where the airway become narrow and inflamed, such as asthma and chronic obstructive pulmonary diseases. The bronchial asthma is characterized by airway obstruction, narrowing of bronchi, which leads to dyspnea known as difficulty in breathing. The factors like allergens, drug, cold air, histamine causes the asthmatic attack. The exact cause of asthma isn't fully understood, but it's likely a combination of genetic and environmental factors. If the family have the history of asthma, can increases the risk. Environmental factor includes exposure to irritants, respiratory infections, and occupational exposures. The types of bronchial asthma are episodic form, status asthmaticus, and chronic asthma. In episodic form, in these, it is the cause due to the allergens on respiratory tract, and the person suffer from these can respond to the bronchodilators. In status asthmaticus, it is the acute attack which is associated with the respiratory failure. They do not respond to the bronchodilators. In chronic asthma, there is a dyspnea. Dyspnea means difficulty in breathing. There is thickening of bronchi which leads to bronchospasm. It is related with excessive mucus secretion. The classification of bronchodilators includes sympathomimetic amines. In sympathomimetic amines, there are drugs with alpha and beta effect. Example is adrenaline and ephedrine. Drug with beta 1 and beta 2 effect. The example is isoprenaline, and drugs with beta 2 effect. Example is salbutamol. And second one is anticholinergic drug. Example is atropine, and phosphodiesterase inhibitor. Example is theophylline. The pharmacological effect of sympathomimetic. The slow reacting substances causes the bronchoconstriction. Sympathomimetic amines acts through the cyclic AMP mechanism. Sympathomimetic amine increases the adenyl cyclase activity, which promotes the conversion of ATP to cyclic AMP, thereby inhibits the slow reacting substances, histamine and other factors, thereby causes the bronchodilation. And the mechanism of phosphodiesterase inhibitor is the phosphodiesterase enzyme reduces the level of cyclic AMP, thereby causes bronchoconstriction. Thus, this inhibitor inhibits the phosphodiesterase enzyme and increases the level of cyclic AMP, thereby inhibits the slow reacting substances, histamine and other factors, and produces bronchodilation. The example of phosphodiesterase inhibitors are theophylline and aminophylline. The treatment of status asthmaticus includes hospitalization, then initially administration of aminophylline by intravenous route, hydrocortisone, then salbutamol, then broad spectrum antibiotics and bronchial lavage to remove the excessive mucus secretion. The bronchodilators are the pharmacological agents which, when administered, they produces the dilation of bronchi, which means bronchodilation, and prevents and also relieves the symptoms of the asthma.